Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Ranolazine. Ranolazine is an anti-anginal drug. It is also used as an antiarrhythmic, but still it is under trial. It will block potassium and sodium channels, and ranolazine can be used along with combination with dronedarone. This dronedarone is an analog of amiodarone. So ranolazine with dronedarone combination is actually under trials now. This is under the clinical trials for the suppression of the atrial fibrillation.
thank you and thank you for watching.